So we're shifting gears, folks. As Reverend Dr. Lund and I were sort of collaborating on today, Sarah comes from Indianapolis, and that is not exactly local to New Haven, Connecticut. So we thought, okay, how can we bring some local resources for you all who may have youth in your communities who are struggling? What can we do here locally in the New Haven region, and for some of you a bit beyond that? But we wanted to bring someone some folks who had some wisdom for this area that they could pass along to you. So I'm going to introduce our guests and let them we'll ask a few questions here and there, but also I would encourage you all, I will have a handheld mic, and if you have a question, just raise your hand and I will be sure to come to you all as well. All right, so first up we have Dr. Frank Gregory, he, him pronouns. Dr. Gregory is a licensed clinical psychologist and is currently the administrator of Behavioral Health Community Services Division at the Connecticut Department of Children and Families. Thank you for being here. We also have Dr. Siri Kanya Chirarok-Moncon, also she, her pronouns, who is a public psychiatry fellow and a member of the board of NAMI Elm City, NAMI being the National Alliance of Mental Illness. And we have Sam Bird, they, them pronouns. Sam is a queer and trans identifying educator who has served in multiple settings that I could go on and on about, but very glad to have you. Here at Yale University, Sam is the director of LGBTQ+ resources. So we have some real wealth of experience and wisdom in the room. I would invite you all to be pondering questions as we've been asking you to do thus far. And I will kick it off with the questions and then hopefully let you all take it away because you'll have more relevant things than I. But we'll start. So I would love for each of you to take a minute or two and share what the most pressing mental health issues might be for the young people right now in this season in April, it is April 2024 here. What are you seeing in your realms of work? What are you noticing in the lives of young people that requires this kind of work?
Hi, good morning, everybody. Can you hear me okay? Yeah. I go by Sanya. So I work with young people clinically in my early psychosis clinic. I'm also part of the NAMI board, where we do a lot of outreach and also legislative advocacy work. In my clinical work, I would say the biggest things that young people struggle with is loneliness. They don't really know where to go to get the resources that they need. They don't really know how to confide in people when they are struggling because they feel like I think they have to make sure that their parents are okay, make sure that their peers are okay, but then they themselves don't really know how to navigate the world yet, and they feel like there's so many things that's out of their control, and I think just struggling through that process in today's world is very tough. Yeah.
Hi, I'm Frank. I would echo that, and I think loneliness and disconnection. And we know that we've come through, quote unquote, through a period of great disconnection, right? Several years of everybody having to be separate, and particularly for kids, the disruption to normal development and school activities and peer activities and learning and. So I think, the impact of that on kids are learning machines, right? They learn, they develop, they practice things. And so the interruption in their being able to practice social connection, social interaction, I think, we can't really minimize. And I think it's been said, youth rely on the adults in their life. And in some ways model, right, what they see. And we know that many adults are struggling also. And then one more piece, and then I'll shut up. This. So if you think back, right, to your own experience of shame, awkwardness. How could you wear that to this party? And why do you want to talk to them? And all of that. And imagine times 1,000 and in front of everyone you know and don't know, and it never goes away. So that's tough in ways I don't think we really yet even understand. So it's tough to be a kid these days. It's always been tough, and these days it's got some particular challenges.
Loneliness, the flood of media and content into their mind space, from social media in particular. Definitely want to echo those two. I see that quite a bit. I also want to kind of talk a little bit about climate and context too, of where we find ourselves in April, especially when I think about working with our queer and trans youth. These students are seeing a lot of injustice in the world, and they are experiencing a time of hyper polarization, a time when almost everywhere they look, they're seeing we versus them, like this kind of constant tension. And in the past year alone, I think by the end of last year, we've seen the most concerted effort against queer and trans people in particular, through legislation, through miseducation, misinformation. We had over 500 bills introduced in by legislators across the country just at the end of last year, and this year's proven to be even worse. Just 4 months in, we're already at 484 bills that are targeting things like barriers to accurate ID, free speech and expression, so banning our art forms, banning our books in schools, thinking about visibility, the ability for children to see other stories of people that share similar identities to them, healthcare restrictions, public accommodation bans, restricting students' and educators' rights, so the ability to play sports, things that bring people joy, the weakening of civil rights laws, and other anti-LGBTQ bills. Those are just a few of the things that are swarming around in this socio-political mindstorm that's flooding into the minds of folks and creating anxiety, creating depression, limiting joy. Those are the things that I think are pretty concerning.
Yeah, thank you all for that. I mean, I'm reminded of something that Kenda Creasy-Dean, Dr. Dean out of Princeton Seminary says, which is that all adults are really children but with wrinkles. And you know, there's a lot of truth to that the things that affect our young people are also affecting us as adults. The difference is that we have a couple of decades on these young people, so we have some sense of, on our best days at least, hope and trajectory and knowing that this is not the last day, right? But it's difficult. It's difficult to provide young people with the tools that they need in that very formative time period of their lives. So as we think about things like, you know, I heard you talk a lot about loneliness, a disconnection, social media struggles, and then also the wider culture of all of I'm thinking of like static and all of the painful static that is coming, and it just seems to kind of pile one on top of the other on top of the other. So, okay, we are aware of some of these things, I think, in the room. What are some good local resources for these things? So most of the folks in this room, how many of you all work with young people on a at least weekly basis? Yeah, thank you. So I think that's why most of our folks are here. What should people who work with youth have in their back pockets or in their cell phones to be able to say, here's a good resource, here's what I need to, whether physically, here's where you need to go, here's the number, or metaphorically, here's what I need to be aware of as I'm encountering these things. What should these folks be taking away?
I would start with, in terms of, you know, the important resources for kids. You are, so thank you. And the work you do. Because one of the things we think about is, where can young people go when they're struggling? Well, we want to start with, where are they already? And that's where you are with them. And so really, we want to not minimize that. I guess as far as other resources, part of it depends on where, for lack of a better word, in the stream you're encountering that youth. I heard some of the previous presentation and would certainly agree with what was said. So, there are resources that are intended to pro-socially support kids and their connections so as to sort of stave off, right, the development of difficulties. There are other resources that are able to intervene when things are a struggle and yet still sort of together. There are resources that are in place for when things have fallen apart and or crisis and or urgent crisis. And so as a state, we're actually very well resourced. We're also a state where the resources are quite inequitably distributed.
Yeah.
And so, right, we sort of have a bounty and not everyone has access to it. And we know that many of the struggles we see are the result of those inequities. The socioeconomic disparities, systemic racism, right, that people struggle as a result of things that have been done to them, or LGBT youth, the messages and that they've been given, or the discrimination that they've already had to contend with. And so I guess just two things, and again, then I'll be quiet. I would say that, as I said, being a resource to them to counter those messages, right? The messages of separation, don't trust, right, other people, get what you can, and if it's at the expense of somebody else, that's how it works, right? All the things we can do pro-socially to counter those messages. And there are an array of mental health supports and services available to kids in Connecticut. In Connecticut, if a kid's in crisis and their parent calls now 988 and or 211, a licensed clinician can be in their home in 45 minutes, anywhere in the state, 24 hours a day. That's an important resource, right? It's a resource that, as I said, depending upon what's going on, you may or may not need that. We have a network of outpatient clinics, child guidance clinics, outpatient clinics for kids. Here in New Haven, there are several. Actually, the child guidance movement was started by a person named Clifford Beers, and the clinic in New Haven bears his name. Yep. The Yale Child Study Center, all of the cities around the state have walk-in access or ready access to supports and services. We're also, the places that we need to continue to enhance are schools, as we heard. We're partnering with the Department of Education to fund some peer-to-peer supports. And again, as we've heard, it's peers in the context of supportive adults. And so creating structures that support them.
Okay. My mind's going like this right here, right now. I think connection is extremely important. So if folks are feeling isolation, how do I connect youth to other community members, other support resources? Because you may not know everything. You may not have all the resources. So thinking and looking at your communities and seeing what resources are already established there. I know like here within, for the LGBTQ community, specifically like in New Haven, thinking about the New Haven Pride Center, the Yale LGBTQ Center, which is what our title will be after this summer. and the variety of affinity groups and support groups and stuff that are situated around supporting our youth. Sometimes as leaders, we will find ourselves in contexts and situations where the resource just has never been created. And sometimes that falls back on us to be advocates, to be able to see the problem, or be able to be in conversation with the youth who are identifying the problem, because they're going to be most aware of, what's happening, whether it's I need help, but my family's not supportive, and I need to be connected to someone that can support me with this issue. The school just doesn't get it. They're misgendering me, or they're dead naming me, using the wrong pronouns, the wrong names. And I don't feel good when I come to school. Like, just being that listening ear, taking what you're hearing and then being an advocate, going to the schools, going to your churches, and initiating change, going to the legislators. What we're seeing that with all of these laws being enacted or being introduced across the country right now, it's being targeted at the local level. We're seeing most of those things coming out of school boards where they're making changes that are continuing to make life very difficult for underrepresented students in particular. So figure out who your allies are, the support resources around you within the context that you're in, your own institutions, your own churches, your own communities. And then if you see those problems arising, how can you build a network of support to change things, to make new resources? I think that's what we're going to see a need for more and more and more as we move into this next decade.
So NAMI has a youth support group. I think it's twice a month. I can look it up on what the day and the time exactly is, but it's open to all diagnoses, even if you don't have a diagnosis, if it's a peer support group. And when I think about, to zoom back a little bit, when I think about resources, I think about it in clinical and then non-clinical buckets. So when I think about non-clinical buckets, if you are experiencing loneliness or disconnectedness, even things like joining your local sports group, joining the baseball team or the basketball team, those things are tremendous, and those are already built into the school system. And then I think about clinical services, things like calling the 988 number or going into the emergency department, getting connected in an emergency, in a crisis situation, having access to those resources. And then also being able to find yourself like a weekly therapist that you go see, or a psychiatrist that you see. There's even specialized clinics. So I work at Connecticut Mental Health Center. We have the first episode psychosis clinic there for people who are 16 to 30. So if they are experiencing psychosis specifically, having access to those, it's open to everyone. So bringing them to those specialized clinic. So those are two sort of clinical and then non-clinical resources. But then there are things in between, the gray areas, which is the peer support groups. I think those things are invaluable, and I think it's actually so helpful. Whatever the young person is identifying as their most prominent difficulty at the time. So let's say they're struggling with their gender identity, helping them to look up those specific support groups, I think are really great resources. And again, NAMI, like Elm City, if you just look up NAMI Elm City, we do have a youth support group that they can join.
Please go ahead.
Oh, yeah, I didn't hear the name of the organization that has the psychosis clinic.
It's at the State Mental Health Hospital. It's called Connecticut Mental Health Center, CMHC. It's across the street from Yale, New Haven Hospital.
Okay.
And that is not specifically for kids,
I
but
understand.
in one clinic that we have, it's for first episode psychosis, and we serve people from 16 to 30.
Are there other questions? I'll pass the mic around.
Thank you so much for a lot of information and the good lectures. But my question is, first of all, so there's tons of the solution, but Actually, children need to ride. And then trustful, adult, Dr. Sarah says 3, but they cannot trust their parents or teachers. I'm a teacher on public school in Fairfax County. I think I have a question here. Everything is beautiful, like a lecture book and then solution, but who connect? Who get the responsibility? Teachers don't have authority. So kids says, I'm gonna sue you. So they just come to school 7:30, early in the morning, like a middle school student. There's no homeroom teachers. They just go to math class, period, and go home. Who care? There's counselor, but one counselor, 300 kids. Who care? So this is, we need every solution things. We need knowledge, but kids need attention and an adult. But how can we? And then another question is behavioral disability, emotional disability, and then behavioral or learning disability. Why we use that kind of a disability? They just overcome if adults just take care of the 1 month, 2 months, take care well. They just go to a regular class, but they hurt themselves. They know I'm a disability. I'm a some ADHD. I do. They just lost hope. So maybe like doctors and the professor, you guys, I hope. I just really wanted to change their lane. So like obese, I'm a little bit like that, but we says queen size, right? King size, queen size, how beautiful. Why we use like a disability to like my kids? So I have 4 boys. They are all like good, smart, everything. But who knows, my grandchild, someone. But I don't want to use that kind of disability class things. So can you change it? So you guys can do, I think. Thank you so much. I'm Ariel from the Fairfax County Public School.
Just a couple of things in reverse order. I appreciate what you said about the term disability. Now, terms are, on one level, right, just a bunch of letters put together. The meaning it has is meaning we've given it, right? So to the extent that we have determined it to be bad. I mean, as you know, as an educator, right, part of how that works is, unfortunately, there are classifications that are needed to afford kids certain legal rights and to afford the systems, to require the systems to address those rights. But point well taken, that language matters. And so, how we can be aware of that and support the kids. The other thing I'll say, and to echo, I think, part of what you said, kids live in the context of families, at least many of them, we hope. And they rely on families for support and well-being. Families live in communities and rely on communities, local communities, neighborhoods, faith communities, for their support. And I think that's one of the things that, the loneliness, the disconnection, it's not only on an individual level, we've seen it sort of in communities. And so in terms of what we can do to really reinforce caring, I think it's how can we partner with each other in our local communities to build some of those supports and bonds. And we know, if you're struggling, one of the things you can do that helps is to do something for somebody else. And so if we can make enough connections with people doing for each other, that is a start, I guess. But thank you.
Is it Ariel? Yeah. I just want to say thank you so much for your courage and vulnerability in speaking up about the challenges that are being faced by our young people, especially at school. I can hear the frustration and the hopelessness that's cyclical and very unfortunate in today's world. And I think it is very frustrating to see that, that our kids are struggling, to see that there are things that we want to be able to do to help, but then that we're not able to help as much as we wish. I think that part of that is the society that they're inheriting. And, I don't think there's an answer to this. And actually, I think part of why it's like this way is because of like our generation and the things that we weren't able to do. Like we weren't able to name disability, or that we weren't able to talk about I have ADHD or I have depression, in our older generation. So now the kids are over-labeling themselves at times, perhaps when they shouldn't be, or using it as, I think the teen word is like clout, that like, oh, if I have depression, now I get more followers as a result of being able to have the courage to speak up, because our older generation didn't get that opportunity. So I think in some ways, my hope is that, as adults, if we're able to embrace those things and acknowledge those things more, perhaps our kids wouldn't have to.
I think prevention is important. So our school has a subject like a math, English, blah, blah, blah. But there's nothing is for the character. So maybe they don't know about the life skill. Even 8th grader, they don't know about the college stuff or something. So when they are very young, so we not focus on the more math and things that other than I think maybe newspaper or the good side newspaper. So our newspaper nowadays is always accident, shooting, so they see bad things more than the good things. So even kids always stuck to school. So school subject is more beautiful things, and then good life skill things, character, and then communication things. So we are a church base, so we can help. We have a lot of church pastors and then educators, so we can help for the public schools or schools. Now a lot of teachers, they don't want to work. They just take a break or something. Kids know teacher less pay, so they don't wanna. Even kids says teachers' money is very cheap, things. So they don't have any star. Here's a star, I think. But it's a long time ago we have heroes, but nowadays kids don't have they not respect teacher, they not respect president because of bad things they see. So school, they always in the school, so school give to more good subject for the time to see beautiful things. I think that's my first suggestion.
That's one of the things that as LGBT centers and stuff thinking around, so our center is one of over 300 networked LGBT centers in the country. And I think since COVID and how it exacerbated a lot of the disparities that our communities have been experiencing and stuff, we've had to rethink some of the strategies that we implement within our centers. For our center at Yale, one of the things, when I started in the role 3 years ago, when I transitioned from California to the Northeast, and I just heard time and time again that students didn't want to overanalyze their identities anymore within our spaces. They wanted to do fun things, be in community together, to do joyful things. And so we've had to really rethink these systems and institutions that we're a part of. And I think that schools are another area that really has to rethink. I mean, of course, there's all these curricular considerations and things that students have to know, but there's a lot of learning that occurs, like around empathy, around life skills that you mentioned, and I think that that's getting pushed to the wayside in a lot of our spaces. So, and sometimes parents aren't able to teach that in schools if they're working extra hours just to make ends meet. So, like, as a society, I'm wondering, like, how do we introduce more of this, like, mentality of choosing joy and learning these lives. I don't know all the answer, but I'm just thinking about it within my locus of control in the areas that I have. I shifted a lot of our strategies, and now, like, we don't do some of those things that we did before COVID. And I'm seeing a change in just kind of how our space runs, but it might be worth taking to other spaces, to our churches. I know a lot of times when we think of churches, we think of the brick and mortar buildings and stuff where we go and gather, but maybe it's time to think about church differently, you know, that's outside those walls. Maybe it's time to think about schools differently. Think about healthcare. Like, we have a broken system. Everyone knows it. We're over-medicalizing our kids and our adults too. So anyway, I'll just end there. I could go on a tangent.
Yeah, I'll add my lovely 2 cents, but as a local church pastor, and I know I'm one of a C in the room of those folks, it's really interesting, as one who also has experience in youth ministry, to think about, a number of years ago, there was a lot of talk of, we have to be serious with our kids. We have to get them to really talk deeply because they're off having fun for the majority of their days, and we need to, teach them really important aspects of faith and get them to think critically and theologically and all this kind of stuff. And since the pandemic, what I've been hearing from you all and others is that the tide has really changed here. Our youth are so overscheduled, and that's not new, but they are so overscheduled, and the schedules are so rigid throughout the school days and in their free time, that what I'm hearing is a return to something that I sort of hated 10 to 15 years ago, which was the kids just really need a safe space to have fun. And churches can offer that, which is interesting, and I'm not saying we should, throw the baby out with the bathwater in terms of tending to our young people in critical junctures of their lives and taking care of them spiritually and giving them the tools to really ask those good, deep questions about God and spirit. But it is interesting that I've noticed the exact same thing. In the past couple of years, there's been a return to our children need to be children. And they need to play. And I don't have a way to tie that up in a bow, but I'll just leave that out there in the ether for you all. But I know you have a question.
Yeah, my question is regarding the services in our community. What I hear from parents and those in my community is that our system is broken down. I agree wholeheartedly with what you said earlier. Because the model that we're using is a model that probably could have been used 40 or 50 years ago. But we're still using the same model, especially when it comes to preventive services. Parents tell me all the time, unless your child is telling you that they're about to kill themselves or harm themselves immediately, you could wait months to get therapy somewhere. So Connecticut, and the thing is, we're fortunate because we're a very wealthy state. We have Clifford Beers here in New Haven. We got Yale, whatever. But a parent in New Haven could wait 3 to 4 months to get their child in for individual therapy. So until that child says, I'm going to harm myself or harm somebody else, that's when they get services. We should not be operating like an emergency room. It shouldn't be you only get services until it's almost too late.
Can I speak to that? So there's definitely a lack of child and adolescent psychologists, social workers, psychiatrists, all across the spectrum of individualized one-on-one care, and that is the unfortunate reality. And I do think that's why peer services are so important. going to those like peer support groups are actually proven to be just as effective as even like individual therapy. So there's research in other countries about, in Zimbabwe, for example, grandmothers deliver basic like psychotherapy to their community, and they just sit on a bench, and that actually is proven to be more effective in reducing symptoms of depression and anxiety than the individual going inside the clinic itself. So I just don't want us to discredit the work that we can do as well in our communities and in our families, and also in peer-led services and in peer support groups.
I'll just add too that, and even when the system has what might be responsive, it's often too hard to be able to find it, and the people who need it most don't know how to go about doing that. And so that is a fair criticism, that we need to do better to make what we have not only equitably available, but more easily available. Another resource we do have, again, not as much as we need, but in addition to peer supports, or a different kind of peer supports, is we have a network of family advocacy groups. Well, NAMI is, that's one of the functions they serve, but there are other advocacy groups of parents with lived expertise of trying to manage the system on behalf of their kids, and in turn then serving as advocates, as care coordinators, as partners in seeking care. FAVOR, F-A-V-O-R, and it's actually, sounds like an acronym, but it doesn't stand for anything, is a statewide organization of family advocates. And so, again, thank you for your concern, and it is something that we need to continue to work on.
I deeply lament to say we have about 10 minutes left, and I see a question here.
Good afternoon. I'll stand up so you can see me and I can see you. Mine is sort of like a question. In the state of Connecticut, I am from Massachusetts. I am a mental health counselor. Question and maybe create awareness of something that I'm seeing a lot happening, and I guess it's happening here too in Connecticut from what I just heard. I wanted to know really if anybody thinking about the undocumented immigrants. I work with undocumented youth, and I am lucky to be one of the rare cases, or if maybe I'm the only one, I have no clue. I haven't encountered in Massachusetts another person that does the work that I do, because an organization, a nonprofit, found a way to get funds to hire me as a mental health counselor to provide mental health for the undocumented who don't get insurance. So I don't know how it is here in Connecticut, but in Massachusetts we are inundated with immigrants from Central America. I'm from Nicaragua myself, and there's no mental health for them. I work in one town only. I don't even want to think about the rest of Massachusetts, and I don't have anybody else working alongside me to see this whole population. And as I was saying to some of you already 50% of the youth at the high school, 50% are Hispanic. That's a high school of 4,000 students. What's going to happen to these youth? They're coming with trauma, all of them, okay? Some of them are very severe trauma, others, they come here with no support. So I wanted to know if Connecticut is facing some of this, and if it is, then this is 2 states in New England, which are the states where they're the ones who begin, and then it spreads throughout. I know in California there's a lot of help, I guess because immigrants have been coming there for a longer time, I guess. Immigrants of my kind, because they're different immigrants. We're not white, we're color immigrants. So for us, the help is not as readily available as it is for the white immigrants nowadays. And that's a reality. I mean, it is what it is. We're the new immigrants. But I just wanted to find out if in Connecticut it's happening, and if it is, then like we have here Department of Children and Families, and even though they do take cases in Massachusetts, they can't do anything because the funds do not go to undocumented, only for kids who are from. Even though they do open cases, they can do zero for this youth. They just, excuse me, get in my way because, they're not really doing anything but complicating the situation. Sorry about that, but, But I just wanted to say that, and I don't know if there's, I don't know.
Thank you. A couple of things, I guess. One, I realize, I'm probably going to say again, we have some and not enough, and that is certainly a theme. And in terms of what you describe, again, something that continues to be an issue is, right, how to access care. And not only access, like, nowhere to get care, that there's a way to pay for, and then we know too often, and can it be delivered with someone who speaks the language you do, right? And so can you receive care in a way that feels connected? And so we fall short too often on each of those. I can say that there have, and this has relatively recently been, there's been progress in making, for children at least, children who are undocumented, who are otherwise uninsured, can access state insurance funding to fund services. It's sometimes experienced by families as you can imagine, right, sort of a threat. Okay, I have to go to the government. And that can feel understandably unsafe. And so I think that gets back to the role really of local communities, faith communities, local leaders who can partner in both helping those who need the supports feel safe enough to access them, but also to hold us as a system accountable as you're doing, because it really is important for the system to continue to be challenged to ensure that we're doing what we need to do for that. So thank you.
At Connecticut Mental Health Center, we do have the Hispanic clinic. It's monolingual, Spanish speaking only, and that's the clients that we serve. The wait list is very long, and people do have to be Spanish speaking only, as in they can't be dual English and Spanish speaking, because there's just not enough services. That's the one resource I know, but unfortunately it's definitely not enough. Yeah.
I relocated from California, so I've seen a major difference in undocumented resources versus all the wealth of resources that we had there. And on my team, I do have a non-traditional student who has worked for a couple of years at a nonprofit in New Haven as well called Iris, and they do a lot of work with the immigrant community here in New Haven. And I'm sorry I don't have more information about all the different types of services they provide, but I do have that at the forefront of my mind. And just like looking over the trauma that you mentioned that these folks are presenting with, like from their travel to like to what they're experiencing here in the States. And looking at the Trevor Project's data on queer youth in particular, we can see that especially our Latinx community, our MENA, so Middle Eastern, Northern African, and our Native and Indigenous communities. So if we think intersectionally about some, even the materials that I have here, like the more marginalized identities an individual has, and the greater they're going to experience disparity here. And so I think it does make us think about how do we offer services. And one of the services I've really been pushing with my communities at Yale, just out to whether it be the med school or law school or whatnot, is information from Immigration Equality, which is a national organization that explores some of the issues affecting undocuqueer people. And so that's another national organization that I could share with folks. Immigration Equality. And they do a weekly newsletter that gets sent out with different resources. It's been really helpful for me as a resource professional just to have that constantly scanning those and seeing what's available that I can share with members of our community.
We have 1 minute left. If it's a quick question, you can try. Yeah.
Just a quick, and it's actually, wow, just a big wow. Thank you so much for everything. I'm just really touched, to put it lightly. But I want to just take this one moment to just say, I thank all three of you, and I thank Reverend Sarah. But one thing that really strikes me, and I really want to highlight it in context of, we're talking about resources and lack of resources, but resources that we do have. But it really struck me as a takeaway, what Dr. Frank said was that the most important resource in your life is you, is for the youth in your life. And you want to start with where that youth is. And if that youth is in your life, you're part of where that youth is starting. This is just, I hope it's helpful to to be a resource in their life and embody a message that counters the messages that they've been struggling with. That's a real place to just, for me anyway, to just know, I've got to remember that. As I'm looking for resources, as I want to tap the kids into greater resources, but to know, hey, I'm a resource right now in this moment. And I think that's really empowering.
And I'll just say one other thing. Connectingtocarect.org is a website that has a sort of statewide, mostly in the behavioral health realm. There's also a tool in there that you can say, I live in Waterbury and I'm concerned about my child whose difficulties are moderate in the realm of mental health, and it will say, well, here's some folks you may consider calling. So connectingtocarect.org is a useful resource.
And I just also want to make a plug for NAMI. The NAMI Elm City, I think it's only like $20 for you to be a general member. And really, you don't have to come to anything unless I think a lot of it, we still need a lot of legislative changes. And we do need a lot of the voices of people who have been affected or who are directly working with people who've been affected to advocate for change to be happening. I am very embedded in the mental health care system, and I unfortunately don't see it going too well. I think there needs to be a lot of advocacy work on our part. Yeah. And there's a lot of resources like NAMI Basics. It's for parents, caregivers, and other family members who provide care for people under the age of 22. I think that's a really helpful resource. So lots of things in NAMI, yeah.
And just offering myself up as a resource for anyone that may be navigating gender or sexuality concerns with youth. I'm pretty well connected on the national level, but also want to kind of highlight the New Haven Pride Center as well. Juan Carlos, my equivalent at that center, he does a lot of outreach here within the city of New Haven. And so if you need to reach out and see what affinity groups or support groups are available, we're happy to connect you.
Yeah. Frank, Siri, Kanya, and Sam, thank you so very, very much. Can we give them a round of applause?
Thank you.
I'm going to take a point of privilege and invite us to I invite you all to take a breath. I invite us to breathe in And breathe out. And remember that we are indeed breathing in and out life, and that we are good resources for our young people, that we breathe life into them in the love we show them. And I hope that this has been very helpful.